are the patients should those dollars be really focused on? We really believe that those relationships will be better driven if it's identified that these are patients that have a chronic disease that really need additional resources, and fund those patients. The reason that we're going down that road, and so that would be a subset of your practice based on severity, it's a severe instance severity adjustment piece. There's two reasons we want to do that. One is that anybody who's been involved in that process, the rosters that you get that you decide whether this is my patient or not are always a contentious issue. We've been doing this with payers for an awful long time. And everybody in this room, from what I heard in this last round of questions, was an awful lot of this. We really think that that has to change, or we're not going to get away from that, and we want to be one of the change agents that makes that happen. So we feel that in any given primary care practice, that if it's fairly easy to identify your chronic patients, whether that be 5% of your patient population or 30%, it's fairly easy to do based on decent ICD-9 code. So that it's instantly a severity adjustment piece. We also feel we'll be able to pay on a per member basis a bit more than the $3 that may be out there in different carriers. We'll be able to pay more because we're paying less numbers of patients, but they'll be focused around the patients that really need those services. So that's a first step, a very practical first step, and that will be rolled out over the course of the summer to identify specifically what we're going to be looking for. One of the reasons that we feel it's important